and they have to also be able to synchronize their breathing with the accentuation of this device. The proper technique for using the metered-dose inhaler involves a series of steps. The first step involves shaking the canister for 15 seconds to make sure the medication is ready for delivery. Then the device is held in front of the mouth about an inch away. The mouth is held open. The individual exhales out. During inspiration, the device is actuated. You then inhale deeply, hold your breath for up to 2 seconds, and exhale back out. Then, depending on whether the prescription calls for additional breaths, you wait 30 seconds between puffs. There's a lot of issues involved in using this type of device correctly. Some studies have shown that 75% of patients have ended up discharging the device while they were exhaling instead of inhaling, or they did not have good hand-to-eye coordination and discharged the device into the side of their face. That does not provide a good treatment. In response to that, a device was introduced into the marketplace called a holding chamber or a spacer. This device, when connected to the metered-dose inhaler, eliminates all of the problems associated with hand-eye coordination and synchronizing breath. What happens is, again, the device is now discharged into the chamber. The medication is held in this chamber. The large particles rain out, leaving fine particles that will deposit deep to the lungs. So the appropriate way to do it would be to discharge, breathe in slowly, attempt to hold the breath, it's not entirely necessary, and exhale back out.
The two most critical issues in instilling eye drops in a patient is, number one, to get the drop in the eye, and number two, to keep the drop in the eye. What I like to do is to seat the patient comfortably in a chair, or if they have difficulty raising their chin or moving their head, to lay them down on a bed works as well, and to have them tilt their head back and look up to the ceiling. That rotates their eyes so that they're not looking at the drop as it falls. And at this point, I just instill one drop into that sac and keep holding that lower lid away from the eye just a little bit, massaging it slightly. I like to encourage the patient not to immediately blink and shut their eyes very tightly, because that can squeeze the drop right back out of the eye. We do the same to the other one. Relax. Okay, and then it's important to keep that drop from draining out of the eye through the nasal passages. So I use my thumb and my forefinger and put slight pressure on the inner corners of the eyes where the drainage canals are. I hold that for about 10 seconds. The patient relaxes. If the prescription dictates that the patient is to have 2 drops in the eye in a row, it is very important to wait a minute or 2 minutes before instilling the second drop. If you don't, the second drop that you put in the eye will simply wash out the first one, and you'll only get about half the effect of the medication. Now, applying ointment to the eye is basically the same process, but it's a little bit easier to do, and it's also quite a bit messier, so you have to be a little prepared for that. Ointment, you don't have to worry about the ointment flushing out of the eye as we did with drops, because it stays in there all on its own. And once again, I like to have the patient look up to the ceiling, pull down the lower lid like we did with the drops, start near the nose, start squeezing ointment in a ribbon about 1/2 inch long, and when you get to the end of that, wrap it around the edge of the lid, pulling it back away from the eye so that you don't poke the patient in the eye once again with the applicator. Have the patient close their eye easily.
Cold ear medication may cause nausea or dizziness. Warm the eardrops first in warm water for 10 to 15 minutes. Never use a microwave or stovetop to heat eardrops. You could burn the ear canal. Check the label to find out if the eardrops need to be shaken. With the head tilted to the side, place the prescribed drops into the ear and hold for 1 minute. Then use a facial tissue for any residual that may leak out.
How do you know when someone can no longer manage his or her own medications? Here are some guidelines and questions to consider.
Are they impaired physically? Do they have difficulty opening containers? Are they too ill to take their medications? Do they have hearing or vision problems? Can they read? This may result in a misunderstanding of how to take the medicine. Are they impaired mentally? Are they forgetful or confused? Do they know what the medication is for? If they do not understand why they are taking the medicine, they may take more or less than what the doctor prescribed, or they may deny that they need the medication altogether. Are they on several medications that need to be taken at different times of the day? Complicated schedules and the frequent need for refills may be too much for them. Are they taking over-the-counter drugs and natural herbal products with prescription medications? Are they being treated by more than one physician, and do they use more than one pharmacy? There is a greater risk for medication problems when they see several doctors and pharmacies at the same time. Do they have financial problems? The most common medication problem in the elderly is the underuse of medicine. They may fail to refill the prescription, use outdated drugs, or take less than is prescribed in order to save money. You can manage another person's medication in several ways. For people who have difficulty preparing their pills, you can set up a day or week's worth of medication in a daily or weekly labeled container. These containers are available at most drugstores. If they have difficulty getting to the pharmacy to refill their prescriptions, you could offer to pick up the prescriptions for them or provide transportation. Some pharmacies offer home delivery service, and you could arrange that service. For people who forget to take their medications, there are reminder systems available. Load the medicine into the device and then program it for the time of day that the medicine needs to be taken. It's similar to setting an alarm clock. When it is time to take the medicine, the alarm goes off, reminding the person to take the medication. This unit can be connected to a monitoring center. If the medication has not been taken after 30 minutes, the device dials the monitoring center and the attendant at the center calls the person or you directly. When caring for someone who has dementia, due to Alzheimer's or from some other cause, you cannot rely on a reminder system. The ability to think and reason is affected by the dementia, making behavior unpredictable, and you can never be sure that they will take their medication properly. As a caregiver for someone with dementia, it is your responsibility to be with them or arrange for someone to be with them when they need their medication. You can hire someone privately to help with caregiving, or if another friend or family member wants to help, you can teach him or her to set up and give medications. If you receive help from a home health agency, the home care aide is not licensed or certified to set up or give medications. They can assist with medications. Assist means to help, such as remind the patient to take their medicine, help open the container, or steady their hand. The patient must be able to identify the medicine they need. Setting up medicine and giving medicine is the responsibility of the family or nurse. A medical identification bracelet or necklace will alert someone that you have a condition that requires medication or assistance. There may be times when you cannot communicate this information because of illness or an accident. Medical IDs are available at most pharmacies. It is important to store medications correctly. Light and heat can decompose some medications, so avoid storing them on windowsills or in the car. Some medications do need to be refrigerated. Always read and follow the storage directions on the medicine container. Do not automatically store medications in the refrigerator unless directed. Avoid storing medications in the bathroom or near bathroom or kitchen sinks where there is a lot of moisture. Moisture can cause medication to spoil. Keep the medicine container tightly closed and store it in a cool, dry place. Cream or ointment for the skin should be stored separately from toothpaste or pills. Keep medicine out of reach of children or people with dementia. Learning to manage medications is an important part of caregiving. Dispensing and giving medicine is serious business. Be sure you know the purpose of the medicine and the possible side effects. It's important that you read the information that comes with each medication. Don't be afraid to ask questions. Your doctor, pharmacist, and nurse are your best resources, and it's their responsibility to answer your questions.
When you follow the guidelines in this presentation, you will greatly reduce the chance of medication errors and problems.